Hello. So today we're going to go over Parkinson's, progressive supranuclear palsy, and Shy-Drager syndrome. So to kind of piggyback off of what Brody did last week, what causes Parkinson's is unknown. It's a degeneration of the basal ganglia. Parkinsonism is a term that refers to conditions that mimic Parkinson disorders. So that'll come up later. So let's move on to symptoms. One of the major characteristics of Parkinson's is a resting tremor. So tremor when they're not doing anything. The onset of symptoms is typically slow and subtle, usually beginning with a hand. They describe it as like a pill rolling movement, and it disappears when they fall asleep. Emotional distress and fatigue will cause the tremors to worsen. Eventually, the tremors will progress to both arms and legs. It is possible that as the disease progresses, that the tremor will become less noticeable. Smelling is another thing that Parkinson patients experience. It is thought that the decrease in smell is because of the difficulty in sniffing or the inability to take a deep breath, because Parkinson affects a lot of the muscles in your body, pretty much all of them. It's a minor problem, but could potentially lead to undernutrition. Early in the disease, muscles become rigid, and one side of the body is typically more affected than the other. Parkinson patients move slowly, and they have a shuffled gait, taking small steps. They typically have trouble initiating the first movement, and also they walk with no arm swing. Turning and stopping can be difficult for them. Sometimes they will suddenly freeze and feel as if their feet were glued in place. Now, it is possible for Parkinson patients to actually experience faster movements. An example would be like as if they were walking and their steps unintentionally quicken because they have this stumbling run to keep themselves from falling. Also, they might run their words together, turning it into a mumble. Their head droops, and they often rest it on their chest. They also have difficulty with balancing. Another real hallmark of Parkinson is a blank expression. This kind of tends to give them the look that they are depressed, and it can often lead to doctors either missing the diagnosis of depression or misdiagnosing them with depression. You will often see them with their mouth open and they don't blink very much. Drooling and choking is also a symptom that is experienced by Parkinson patients. The rigid muscles in their mouth and their neck make swallowing difficult, so aspiratory pneumonia is common, likely to develop, and can potentially be fatal. Diagnosis of Parkinson's is based on symptoms and a physical exam. A PET scan is optional to see the degeneration. Mild diseases of it are typically difficult to diagnose because their symptoms are subtle, and older patients typically have some type of Parkinsonian type disorder already. Treatment cannot be cured, but can be managed by drugs. Things you can do, encourage them to continue ADLs, exercise, PT and OT to regain strength and muscle tone, eating a good diet, fiber-rich foods, drinking water, prevent constipation, make their home safer by removing rugs or things they may trip over. You could also consider installing handrails so that they can prevent falling as well. Now, drugs. The major drug used for Parkinson's is levodopa, which is converted to dopamine in the brain to offset the lack of dopamine produced. It's often paired with a drug called carbidopa that just prevents it from converting before it reaches the brain. It's a balancing act between the symptoms of the drugs and the symptoms of Parkinson's. After 5 years of use, there is this phenomenon called the on-off phenomenon, when suddenly the symptoms go from being managed well to not at all. And there are various things that doctors can do to counteract that. Other drugs that they can use are dopamine agonists or monoxamine oxidase inhibitors. Surgery is also an option for more progressive diseased versions of Parkinson's. A pallidotomy can be used. It's a pinpoint area in the basal ganglia that is destroyed that can improve the off phase of that phenomenon. Deep brain stimulators can be implanted to improve the function of the basal ganglia. Outlook of Parkinson's. It progresses slowly, so you retain most of your functionality for a while, but eventually it leads to disability. You will need a caregiver for ADLs, and Parkinson's patients should look for and prepare advanced directives for later in life. So, progressive nuclear palsy. Cause is also unknown. It's similar to Parkinson's. Typically begins after 50, and part of the basal ganglia and the brain stem is destroyed. So symptoms. Mostly they're similar to Parkinson's as physical symptoms, but also vision problems occur. They can't roll the eyes downward. They have difficulty focusing on stationary or moving objects. Reading is difficult. The upper eyelids are often pulled back, giving them an astonished look. Gait becomes wide, unsteady, so falling backwards is likely. Speech is slurred and guttural. Swallowing becomes difficult, and aspiratory pneumonia is also likely. As it progresses, insomnia is common. Also, emotional changes happen rapidly. So one moment they could be crying, and the next moment be laughing. So it's common. Depression is also common amongst these. Diagnosis is based on physical, or based off symptoms, and can be often mistaken with Parkinson's. There is no effective treatment. Parkinson's drugs can improve some of the Parkinson-like symptoms, and antidepressants are used for the depression and emotional changes. Bifocals and other special glasses can be used for the vision problems, and if swallowing regresses too much, then they can change their diet, and if swallowing regresses even more, they can even consider inserting a feeding tube. The outlook, it's disability within 3 to 5 years, and typically death due to infection within 10. Patients should prepare an advance directive. So, Shy-Drager syndrome. Cause, yet again, unknown. Typically develops between 35 and 75. It's more common in men. Results from deteriorating nerve cells in the brain and spinal cord, and those affect all of the internal functions of the body. Symptoms, yet again, similar to Parkinson's, with the rigid muscle, tremors, and gait disturbances. Additionally, Shy-Drager syndrome, they experience irregular blood pressure, heart rate, bladder and bowel control, body temperature, and focusing of the eye. They also experience orthostatic hypotension, so they are predisposed to feeling dizzy, lightheadedness, or potentially fainting upon standing. They don't produce much sweat, tears, or saliva, so they are heat intolerant, and they can have dry mouth, dry eye. Mental confusion is also more common amongst these, and they also have difficulty controlling emotions. Diagnosis, yet again, based off of symptoms. There is a test called tilt table test where they strap them to a table, they lift up the table and monitor their blood pressure and heart rate the whole time to see if they have the irregular blood pressure control and heart rate control. There is no cure for this one. Parkinson drugs, unfortunately, don't have much of an effect on Shy-Drager, but they can improve the orthostatic hypotension by various means, consuming more salt and drinking water to increase fluid volume, wearing fitted elastic stockings, not straining during bowel movements, and abstaining from alcoholic beverages. Fludrocortisone can also be taken to prevent blood pressure from becoming too low, and the outlook of Shy-Drager is not great. It's death within 7 to 10 years, typically from pneumonia, and patients should also prepare an advance directive.